Modern science around HIV prevention and treatment and transmission tells us that people who are living with HIV who have suppressed virus, they're on medication, have a suppressed virus, that they cannot transmit HIV to a sexual partner. And we have really good scientific evidence that has come forth in the past few years through reliable clinical trials and studies. Some studies show that there were over 70,000 sex acts between a serodiscordant couple where one was living with HIV, one's HIV negative, the HIV positive partner is on treatment, and there were no transmission events in those over 70,000 sex acts. And there's other studies that show the exact same thing. And so we now have really good evidence that treatment as prevention works really well to prevent transmission of HIV.
People with HIV should care about criminal laws because they're outdated. They are totally outdated, and people are living very long, very healthy with HIV. And it's not a crime to be sexual. It's not a crime at all to be sexual. So it's very important for people with HIV to understand the laws, be updated on the laws, and educate other people so that they know that they're not a criminal because they love someone.
The old HIV control measures that were passed in 1988 in North Carolina required all people living with HIV to disclose their HIV status to their sexual partners and to always use a condom with partners. And if they didn't do those things, then they faced criminal prosecution and up to 2 years in prison. Another scenario that I can think of where the law had potentially more pronounced negative consequences for people living with HIV is couples who were both living with HIV who are in monogamous relationships, their virus is suppressed, and they don't want to use condoms. Yet again, sort of from a legal standpoint, I have in the back of my head that I'm supposed to advise them that they're supposed to use condoms for every sex act. And it really, again, is counterintuitive that a couple in that scenario should be required to use condoms for every sex act, and if they don't, then again, they can be criminalized and prosecuted.
As a person living with HIV, the new science surrounding someone who's undetectable not being able to transmit the virus, honestly, it gave me freedom. It gave me freedom to know that those archaic laws, they don't make me feel so criminalized. So I don't feel criminalized anymore. I feel safe to be able to express that though I'm a person living with HIV, I can advocate for other people and stand on a platform and not feel like someone will point the finger and say, oh, so you have sex with other people and you have this virus. But with the science confirming and proving that a person living with HIV who is undetectable cannot pass the virus, it just gives me peace. That's really a word that I can use. It gives me peace.
I was really interested in being involved in the work to modernize the North Carolina HIV control measures because I've seen over the years, as someone who works with people living with HIV, how that law contributed to stigmatization of people living with HIV. And I think, and that's something that I've always struggled with because I see it all the time in my patients who are living with HIV. They talk about the stigma that they face. And so anything that I can do as a health provider to help decrease HIV-related stigma is very important to me. And when I attended the Public Health Commission meeting, hearing the stories from community members who are living with HIV from across the state was very powerful for me, and again sort of reinforced the importance of us as health providers being involved in making sure that we're doing everything we can to address HIV-related stigma.
Criminalizing HIV does not help. It does not help. It is a huge barrier. When HIV is criminalized, it causes people to, number one, not want to get tested. And those who are already living with HIV, they don't want to tell their status. They don't want to go into care. They don't want to take their medications. They're just afraid. It causes people to, we talk about suppressing the virus. Well, we're also suppressing people with the criminalizing laws.
The North Carolina Public Health Commission approved the new control measures at the end of 2017, and then they went into effect January 1st, 2018. And the new North Carolina HIV control measures state that for someone living with HIV who is in care with a healthcare provider, on treatment for their HIV, and has a suppressed viral load for at least 6 months, no longer has to disclose their HIV status to a sex partner, and they're no longer required to use a condom. The new law also states that if you have a detectable viral load, if your partner is on PrEP to prevent HIV, or your partner is also HIV positive, you don't have to use a condom, though you are required to disclose your HIV status.
Wow, as a public health topic, I don't think HIV belongs in the criminal system at all. No, it is what is the word I'm trying to use for HIV? It is a manageable illness.
Now we know there is no benefit to criminalizing HIV. It does not prevent HIV transmissions and new cases of HIV. HIV really belongs in the public health arena.
Less criminalization, more education, and more testing is what is needed.